The patient is a child, is thin, lean, and there is a reason for choosing this patient regarding the liver span or the size of the liver. Now, when I place the probe below costal margin and give a sweep up to the lower costal margin, and then when I place the probe in the longitudinally in the epigastric region to see the liver angle, I see that the liver is, when I give now I am going to give a sweep to the probe below costal margin, and you see that I can see the liver, I am seeing the liver below costal margin. Number 2, now here you see the liver angle. It's sharp and is less than 45 degrees. This is the liver angle. So, can we say that the liver is enlarged minimally? Now, one thing to be very clear about is that compare the liver with the kidney and see if the liver parenchyma is normal and that it's not diseased or it is diseased, whatever the case may be. Now, in this patient, why we are seeing the liver below costal margin is because and minimally below the costal margin is the reason is that he is thin, lean child, and in such cases it's not unusual to find the liver below costal margin without any pathology relating to the liver whatsoever. Now you see that this is the right hemidiaphragm, this is the liver, this is the outer surface of the liver, the outer surface is smooth, the echogenicity of the liver is normal, no coarseness, no focal lean seen, no calcifications, nothing. Now, echogenicity or echo-brightness of the liver is slightly more as compared to that of the liver right renal parenchyma. Now, this is the right renal parenchyma, and if we compare it with the liver parenchyma, the renal parenchyma shows less echogenicity as compared to the liver, and this is with a normal. Then see the portal veins, periportal echoes. Now you see this is a normal portal vein, normal periportal echoes. This is the portal vein, and these are the normal periportal echoes. This is the inferior vena cava, and these are the hepatic veins. Okay, you see the sharpness of the vessel margins, and there is no dilation of the hepatic veins. The IVC is with a normal. This is the IVC. Okay, and there is no significant pathology seen relating to the liver. So the liver is normal, but despite being normal, it is being seen below costal margin. So be careful not to give it as a pathology. Don't give hepatomegaly in such cases. Always say that although the liver is seen below costal margin, but the rest of the sonographic liver parameters are within normal because of the age of the patient, number one. Number two, because of the thin, lean stature of the child or the patient you are studying. Thank you. Now this video segment is in fact to inform you about a pitfall, to be cautious of one mistake that can be made if you don't know the normal properly or not good in the proper ultrasound anatomy. You see, there is a well-demarcated hypoechoic area seen in this angle. And it appears to be a lymph node. This is well demarcated. You can say that this is a well demarcated hypoechoic 36 into 14 millimeter lymph node seen at the para-aortic. This is the aorta, and this is the left lobe of the liver in longitudinal section. This is the left hepatic vein. Now you can label this area as lymph node, whereas when I give a sweep to the probe, now again it appears as if this is a lymph node at the para-aortic location, this one, in transverse section, this area. Well, this being the IVC, this is the aorta in transverse section, this is the left lobe of the liver in transverse section. Now in fact, this is not a lymph node, it is the caudate lobe of the liver. You see, when you give a full sweep to the area, you will see that, well, this is the ligamentum venosum, which you may label as the outer surface of the lymph node, or a wall of the lymph node. And this is the inferior vena cava, this is the caudate lobe of the liver, this is the aorta, this is segment 1 of liver, this one. And in longitudinal section, when I come to the liver and give an appropriate sweep, here you are, the same area that we were labeling as lymph node is now giving the appearance of being the caudate lobe of liver rather than being a lymph node. As you know, the caudate lobe of the liver is bounded anteriorly by ligamentum venosum and posteriorly IVC courses. So the area between ligamentum venosum and the IVC, this is the longitudinal section, and the area in between these two structures is the segment 1 of the liver. In this case, why it's appearing a bit in prominence is that it has its own separate blood supply as compared to rest of the liver segments, and that's why it retains its equigenicity even when the liver is involved by inflammatory process or fibrotic process. Thank you. This is segment 6 regarding the liver span. How do we measure the liver by ultrasound? You may come across a condition in which you will see that now in this case, let me start from here. We are seeing the liver below the costal margin, no doubt about that. This is the liver which is being seen below costal margin. Number 2, the angle of the liver is sharp. This angle is sharp, seen below costal margin. And now if we talk about the kidney is lost. This is the end stage kidney, fibrosed. So we cannot compare the kidney and the liver in such cases when we are taking the liver span, or the dimensions of the liver. So first thing is that liver been seen below costal margin. This is a case of minimally enlarged liver, because we cannot compare it with the right kidney. So the liver is seen below costal margin. What we do next is that we will place the probe longitudinally in the subcostal region, move it bit laterally, and we will see if the liver exceeds the origin of superior mesenteric artery from the aorta. If it now in this case, this is the aorta, and you can see a vessel arising from the aorta and taking a sharp turn towards the left side. Now this is the aorta in longitudinal section. This is the superior mesenteric artery. This is the celiac axis, and this is the liver. Now you see that if I make a mark over here, then we can see that the liver is exceeding the origin of superior mesenteric artery from the aorta. So this, when you see a kidney, a liver that is seen below costal margin and exceeds the origin of superior mesenteric artery from the aorta in longitudinal section, then the liver is enlarged minimal to moderately. Thank you. This is segment 4 of the study regarding the liver span and size. Now, one important thing regarding the size of the liver is that see the liver angle. This is the liver angle, this one, and it's not sharp, rather it's rounded. Rounded, if you see the liver angle rounded or more than 45 degrees, having an angle of more than 45 degrees, it gives you an impression that the liver is enlarged. Though this rule does not apply to every patient, however, if you do see liver with rounded angle, is one of the signs of enlarged liver. Now, I am again going to give a sweep to the probe below the costal margin, and you will see that liver is visualized below the costal margin. This is a liver with chronic liver parenchymal changes. See the outer surface, mild coarse texture, and I can see the liver below the costal margin. So, seeing the liver below costal margin with rounded liver angle is suggestive of an enlarged liver. Now, then arises the question that how much is the liver enlarged? Is it enlarged minimally? Is it enlarged minimal to moderately? Or is it enlarged even more than that? Simple rule is that focus the liver and the kidney together in patient, with patient in supine posture, and see if the liver exceeds the lower pole of the right kidney or not. If the liver exceeds the lower pole of the right kidney, then the liver is enlarged minimally. Minimal to moderately, sorry. If the liver exceeds the lower pole of the right kidney, then it is moderately enlarged, minimal to moderately enlarged liver. Minimal to moderately enlarged liver. Now you see the liver end is over here, whereas the lower pole of the right kidney is somewhere here. So, as the liver does not exceed the lower pole of the right angle of the right kidney and is seen below costal margin, so with the rounded angle. So this is what we will say is a minimally enlarged liver, because it's seen only below costal margin and it does not exceed the lower pole of the right kidney. Patient is bulky, so becomes difficult over time. Take some time and you will see that you will get the lower pole of the right kidney. This is the lower pole of the right kidney. This is where the liver ends. So this is segment 4 regarding the liver span. Thank you. This is segment 6 regarding the measurement of the liver by ultrasound, real time, or the liver span by ultrasound. Now here I am seeing the liver below costal margin. When I give a sweep to the probe, I can see the liver below costal margin. So this is one finding. Secondly, when I I take the full length of the kidney with the liver, I see that okay, this is the right kidney, this is the liver, and if you see, let's get a better view, a little better view. बेटा टांगे सीधी रखो, टांगे सीधी रखो. Now you will see that the liver is exceeding the lower pole of the right kidney. This is the lower pole of the right kidney. This one, and the liver exceeds the lower pole of the right kidney. This is the liver, and you see it exceeds the lower pole of the right kidney, and therefore this liver is enlarged minimal to moderately. By definition, we will say that because the liver is seen below costal margin, number one. Second, below the liver exceeds the lower pole of the right angle, lower pole of the kidney, even a little bit, is suggestive of a liver that is enlarged minimal to moderately. This is regarding the liver span, liver seen below costal margin. This is the liver we see below costal margin. It exceeds the lower pole of the right kidney. This is the lower pole of the right kidney, and the liver is seen exceeding the lower pole of the right kidney. And the angle is not sharp, it's rounded. So this is a case of minimal to moderately enlarged fatty liver.